Health insurance is not something that's commonly talked about, but when it is brought up, it tends to be people complaining about how much they're paying for their medical costs. An unsettling trend is that high school and even college students have no idea how healthcare insurance works and what kind of system we even have. One significant reason for why this younger generation has little knowledge on the subject is because of the Affordable Care Act, or better known as Obamacare. This act did a number of great things like expanding Medicaid, but it also allows people to stay on their family health care plan until they turn 26. Now, more than a decade later, this act has been changed multiple times and has unknowingly raised a generation of young adults who have no idea how healthcare works or how they will eventually pay for it. The act had many good intentions, but now there has been a vulnerable population created made up of young poor adults who won't be able to afford healthcare or qualify for Medicaid. In this graph, you can see that qualifying for Medicaid as a single adult is almost impossible. You would have to make a little less than $13K a year in order to qualify. That is almost impossible to make a living with for an entire year. People who are independent simply are not paid so little. If their work does not offer healthcare insurance plans, they are forced to pay large health insurance bills or pay medical bills right out of pocket. People might ask, well, how many young adults are really facing this problem? And it turns out, according to the government, 30% of young adults are not insured by anybody. Another doubt might be that young adults simply do not need health insurance. But 1 out of every 6 young adults is already fighting some type of chronic disease, whether it be asthma or even cancer. Our healthcare system needs to be revised. There's clearly a major problem when nearly 30% of the next generation is uninsured because they're unable to afford sometimes life-saving treatment. We are one of the very few developed countries that do not have a system in place that has everyone covered for health insurance. That is a huge problem that most countries have already solved. We can learn from these other countries, however, in finding ways to revise the healthcare system we have in place. Take, for example, what Switzerland did. Switzerland in the 1990s had a similar economy to ours, and they recognized that everyone should have access to healthcare. So they forced healthcare insurance companies to provide basic plans that anyone could afford. They also instituted a law that everyone had to buy these basic health insurance packages. Now, I'm not suggesting that we need the same system, but we cannot excuse ourselves that the problem is unfixable. Plenty of other developed countries have been able to make the transition to allow everyone to have health care. There are thousands of Americans every year that will die from the inability to afford medical care, or they're going to go broke for paying for that care. Change starts with education. I challenge you to find out more from your own health insurance and how other countries have already made changes. You have the right to afford your health care. You have the ability to help our country make this transition. Thank you for listening to my TED Talk.